Is today Thursday?
Mhm.
Oh my gosh, I'm a horrible daughter. Today's my mom's birthday. I didn't even tell her happy birthday.
Oh. That is bad.
It's like, today's Thursday? Yep.
Oh, I just saw it on the papers. Okay, nosocomial infections. We talked about these a little bit last year, but didn't get into any really great detail. Do y'all remember what a nosocomial infection is?
When they can't be treated?
It's very difficult to treat.
One that is rare? I don't know.
No, not rare enough. I wish it was more rare. Nosocomial infections are hospital-acquired infections. So, do you remember talking about that a little bit? Hospital-acquired.
To get it?
Don't have to be, no, but they do happen often in the hospital. So, either as a result of somebody not washing their hands, or maybe taking care of someone's linens and going into the next patient and doing something, and having that bacteria on their clothes. People get them after surgeries, but they're hospital acquired. So, usually they're seen as the hospital's fault. Now, the thing is, a lot of these same infections that are nosocomial infections, we see outside the hospital a lot too now. So, we'll kind of look at that. Look at this where it says engage. This 41-year-old woman presented to the hospital with acute renal failure, which came to be diagnosed as the first presentation of systemic lupus erythematosus. Lupus, you've probably heard of that before, but it's an autoimmune disease. It can be really severe. My aunt actually had a kidney transplant because of how severe her lupus was, and she's young. She's just like, she's in her 50s now, but she's had her transplant for a few years, so very young. It says during the hospitalization, she developed additional complications of lupus, including cerebritis, which would be what?
Inflammation of the brain.
Brain. Mm-hmm. Hemolytic anemia. Hemolytic, what would that mean?
Something about the blood. Anemic means that low iron.
Yeah, or just low. It can be, anemia can be any kind of low. Somebody's patient in the nursing home, when you did your case study, had like 10 different kinds of anemia. Is that yours, Amber? Is that yours?
I think.
Maybe yours. Anemia just means it's low. Low blood is what that means. So it can be any number of things. It could be low iron. It could be, I don't have enough B12. It could be whatever.
Yeah,
it could be lots of different
things.
Hemolytic blood. Lytic means it's like destroyed. So what's happened if something is hemolytic, it means it destroys blood cells. So that's not good. And thrombocytopenia. Remember what any of that means?
Clot in the cell.
Thrombo means clot, cell. Thrombocytopenia is, let me make sure I get this right. Cytopenia on the end. I think it means there's not enough platelets, like not enough blood clotting. But let me make sure real quick. I think penia on the end of that means deficiency. But I say it out loud. When I read it, I'm like, oh yeah, I know what that is. But then when I start to say it out loud, it's something different. Yeah, deficiency. So that means they don't have enough platelets. They don't have enough clotting cells. Also not good. Because after 2 weeks in the hospital, the patient was given vancomycin and piperacillin tazobactam for altered mental status, which just means that she was not unconscious, but not necessarily unconscious. Could be, but altered mental status just means she had a change. So now all of a sudden she can't answer questions appropriately, so something's going on. Obviously, if she had a brain inflammation, that's probably part of that. And leukocytosis of 19,000, which is just an elevated white blood cell count. Why do you get an elevated white blood cell count? Infection. What do your white blood cells do? They fight infection. So when you have infection in your body, you build more white blood cells. Your body starts making more so that it can fight that off. That's why when your white blood cell count goes up when you have an infection. Anyway, it says a few days later, antibiotics were changed to vancomycin and levofloxacin for persistent leukocytosis and low-grade fevers. So it continued, so they changed her medicine. Vanc is a really heavy-duty antibiotic. Has to be very closely monitored. They have to check levels before and after you get doses of vancomycin. A lot of people are allergic to it, but it's just a very, very potent medication. I had a home health patient once that they think, she completely lost her hearing, and they think that it's because it was vancomycin related, because that's one of the long-term effects of that medication if you get too much of it. So the heavy-duty medicine can cause renal problems and all kinds of stuff. Anyway. It says multiple cultures from urine, blood, and sputum yielded no organisms, but the patient was kept on antibiotics due to the fever. Do you know what cultures are? Somebody does a culture in lab.
White blood.
It means it can be blood, it can be urine, it can be like something from a wound. Anyways, what they do is they take a specimen of that and they swab it onto a petri dish. And then they put it in like an incubator kind of area and see if it grows. Okay, urine should be sterile as soon as it comes out of the body. Now there's a normal kind of bacteria you might find in there, but it should be sterile, so it shouldn't grow any bacteria. If it does, you know that there's an infection. Then they can see what kind of bacteria it is, what kind of medication it needs. Same thing with blood. Blood should be sterile, so it shouldn't grow any bacteria. So that's what they're talking about with cultures. They just swab it in a dish and then see if it grows. Although no clear source of infection was identified, antibiotics were continued for 3 weeks, at which point her fever spiked to 38.5. At that time, 38.5 is an actual like fever. Anyways, that time a single blood culture grew vancomycin resistant Enterococcus faecium. I don't know how to say that last one. VRE is what it's known as. Vancomycin resistant. So what does that mean? Yeah, the vancomycin's not going to work because that particular bug that she's got, that particular bacteria that she's got, is not resistant. Is not susceptible to the vancomycin. It's resistant to it. So that vancomycin is not going to work on it. It says a single blood culture grew that as well as a central line catheter tip. So what that means, I've talked about central lines before, but normal, you've seen the little catheters that go on a regular IV, right, the little plastic ones. Well, a central line is just a centrally, it's like a central IV, basically. So they can put it in up here in the neck or one of these subclavian veins. They'll put it in here. But basically, it's the same thing as a regular IV, except that the catheter is longer because it actually goes all the way, they put it into one of those veins, and it actually goes all the way to the tip of where the superior vena cava goes into the heart. So the medicine's delivered very quickly. The thing about central lines, what makes them better, is that they can stay in for a long time. You have to change the dressing every week, and it's a sterile dressing change. But they can stay in for months, whereas an IV in your arm or your hand can only stay in for 3 days. So that's why they use central lines, especially if they're going to do heavy-duty medicines like vancomycin, because sometimes if your veins are kind of thin anyway, and you give vancomycin in a vein, it can cause that vein to get very inflamed and cause problems that way. They don't usually give vancomycin and heavy-duty medicines like that through a regular IV. They'll usually do a central line. But with that being so close to the heart, infection becomes an issue too, because if that line gets infected or contaminated somehow, they're going to end up with carditis, which is what?
Infection in the heart?
Yes, infection or inflammation of the heart. Not good. So, there's a lot going on in this paragraph right here, isn't there? So that's what they're talking about with the central line catheter tip. So when they pulled it back out, they cultured the end of it to see if it would grow anything, and it did. Furthermore, urine cultures grew more than 10,000 or 100,000 colonies of Candida glabrata, which is sounds like a yeast infection. So, which is pretty typical. If somebody's getting heavy-duty antibiotics, they're probably going to get a yeast infection. It can get it in their mouth. It can be in the groin area. It says the patient received a consultation from an infectious disease specialist who recommended that all antibiotics be discontinued. Within 24 hours, the patient defervesced. She remained hemodynamically stable and underwent further treatment for her lupus. So they just quit the antibiotics because the antibiotics were making the bacteria worse because it was resistant. Now, they're probably going to give her some other kind of antibiotic, like a different antibiotic that's going to work better, but it's just bad news. I mean, it takes months. These people, anybody who has a nosocomial infection or MRSA or VRE, any of these resistant, they're always put on contact precautions. So what does that mean?
Means that you
You
have
have
to
to
like
wear
all
everything.
your safety stuff.
Yeah, you have to wear a gown and gloves. It's not airborne, but you do have to wear a gown and gloves. Now, if you're afraid you're going to get sprayed by something or get, some kind of fluid on your face, then yes, you want to wear a mask and stuff. But so becomes an issue. But this, somebody gets MRSA in the hospital, especially if they've had surgery. Now, I'm not talking about MRSA on their skin. That changes things a little bit, like somebody has staph infection, in an abscess or something. That's a little bit different. They're still on contact precautions, but it's not the same as like going into surgery and having MRSA from there. That's bad news. Okay, MRSA. Because MRSA is becoming more prevalent in healthcare settings. According to the CDC data, the proportion of infections that are antimicrobial resistant has been growing. In 1974, MRSA infections accounted for 2% of the total number of staph infections. In 1995, it was 22%, and in 2004, it was 63%. So MRSA means methicillin-resistant Staphylococcus aureus. So that's the resistant kind of staph. Now, we all have staph that lives on our skin. So we get a cut, sometimes you get staph infection, and that stuff happens. But MRSA is the resistant kind. It's very, very difficult to get rid of. And actually, once you've been termed as having MRSA, they're always, every time you're ever in the hospital from then on out, they're always going to treat you like you've had MRSA. You'll always be on contact precautions. It's kind of annoying. But news is, I want to tell you, according to the CDC now, where I just lost my spot. Let me read this. It says the CDC is engaged in a severe, short, and long-term surveillance or infection tracking projects that involve collaboration with health departments, hospitals, and medical centers. Understanding the burden of MRSA, how much is occurring, where it's happening, and how it's being spread is essential for developing effective prevention programs and measuring their impact. Studies show that about 1 in 3 people, so 33%, carry staph in their nose, usually without any illness. 2 in 100 people carry MRSA. There are not data showing the number of people who get MRSA skin infections in the community. That's just because there are so many of them. Although MRSA is still a major patient threat, a CDC study published in the Journal of the American Medical Association Internal Medicine showed that invasive MRSA infections in healthcare settings are declining. Now this is more recent than these notes. Invasive MRSA infections that began in hospitals declined 54% between 2005 and 2011. So that's pretty good. And part of that is just awareness. Hospitals are a lot more aware these days of MRSA, but like when I was in nursing school, MRSA was like this, big ordeal, and it was big to do, and everybody was worried about it. But it's coming down, so that's good. It says there were 30,800 fewer severe MRSA infections. In addition, the study showed 9,000 fewer deaths in hospital patients in 2005 versus 2011. So it is getting better, but it's still something. It's getting better because people are working on preventing it, not because it's just going away. So it's just an active, it's about always washing your hands and wearing wearing your personal protective equipment when you're supposed to. Let's see. It says this study or report complements data from the National Healthcare Safety Network. Found rates of MRSA bloodstream infections occurring in hospitalized patients fell nearly 50% from 1997 to 2007. So much better. Taken together with other reports such as the March 2011 CDC Vital Signs article and a 2013 study showing a decrease in overall central line-associated bloodstream infections. They provide evidence that rates of hospital-onset severe MRSA infections in the U.S. are falling. While it remains an important public health problem and more remains to be done, further increased risks, the decrease is encouraging. So it is getting better, and the thing with MRSA is it's everywhere. I mean, people have got it on their skin, people who have abscesses, especially at school. I think it becomes a really big issue. I read, well, I'll let you read them later, but anyway. Okay, it says MRSA is resistant to most antibiotics found in healthcare facilities, not always, but usually. Should not be a threat, though, to a healthy individual in the hospital setting. Your body, your own immune system, if you're healthy, you get plenty of sleep, you've got good nutrition, you're not going to be as likely to get it as someone whose immune system is down, who's already sick, who's elderly, doesn't eat well, those kind of things. The concerns are that it's really difficult to contain, and it's very, very, very easily spread.
You just have to touch them.
Do what?
You just have to touch them.
Yeah, and then touch your nose, or touch your mouth, or your eye, or, open fingernail, or something like that. Yeah, very easily spread. That's why they put them under contact precautions. Risk factors, like I said, surgery, devices used in invasive procedures. Okay, so I've told y'all before, I knew a lady who they had put in infected mesh. They did a hernia repair in her belly, and the mesh itself had the bacteria on it. The mesh that they used, like a mesh, kind of looks like a net to actually put over the abdominal wall to hold in like a hernia. Burn wards or intensive care units. Burns, just because they are so susceptible to infection because of just the mass amount of injuries, wounds. Age, the very, very young and the very, very old are going to be more susceptible to it. Treatment with multiple antibiotics. Okay, this is why this is why they don't prescribe antibiotics very often, because they don't want to create some bug that's resistant to all kinds of antibiotics. That's why if they think that you've got a viral infection, they're not going to give you antibiotics. Now, used to, they'd give antibiotics for everything, but they don't do that anymore. And this is why, because the more antibiotics somebody has, the more that bacteria becomes resistant. Severe illness or disability, prolonged or repeated hospital stays. Obviously, the more time you spend in the hospital, the more likely you are to get these. And then a compromised immune system. Transmitted or through direct contact between healthcare workers and clients, so hand washing. And these kind of MRSA and VRE and gram-negative bacteria, these kind of bacteria are not, you can't just get rid of them by wiping some alcohol on there or wiping with a bleach wipe. They have to use bactericidal special wipes actually to clean those rooms. They're not, it's not just like your regular cleaning fluid will do it. It has to be, it's some heavy duty stuff. Healthcare workers are the main carriers of MRSA. I don't know if that's necessarily the case anymore, but at one point. Colonization versus infection. Colonization means that the organism is present in the body, but not necessarily causing illness, versus infection means it's actually causing you to be sick. So you can carry this bacteria and it not actually be making you sick at the moment. But the moment that you have surgery or you get sick with something else, it can show up. Not usually spread through the air. That's why you don't have to wear a mask all the time. Okay, identifying it. Symptoms are drainage from a wound. Okay, a wound that won't get better. Surgical incision that won't get better. I've seen people who've had like knee replacements, and for months they were still having major problems with their knee replacement, major pain, or whatever else, redness, swelling, etc. fever and chills, and elevated white blood count, that maybe they can't find any other kind of infection that they have. Common sites are respiratory tract, so you might see it with like pneumonia, MRSA pneumonia, surgical wounds, perineum or rectum, skin, and then urinary tract. So somebody gets a UTI with MRSA. I'll show you guys some pictures in it. MRSA prevention, proper hand washing. Okay, we know how to do that. That's the most important thing, hand washing. Because remember, hand washing doesn't necessarily work by killing the bacteria like alcohol. Alcohol hand sanitizer is not enough for MRSA people. You've got to wash your hands. Do you remember how hand washing works? Why it works?
It's off.
Yeah, it just washes it. It doesn't actually necessarily kill it. Well, if it's got alcohol in it. But it actually, that's why you have to get a good lather. That's why you wash your hands for 20 seconds, so you can get a good lather and rinse all that off. Alcohol is not enough for patients with this. Always wash it before, after you remove gloves, before you leave their room, again afterwards. And then, of course, your standard precautions, contact precautions usually. Okay, community-acquired MRSA. This is like you get an abscess or a boil and they say that it's got MRSA. Acquired by persons who have not been recently hospitalized or had a medical procedure. Staph or MRSA infections in the community are usually manifested as skin infections, such as pimples or boils, and occur in otherwise healthy people. So you can get this regardless. So let me show you some pictures. Let me go back to pictures here. I'll show you guys. Sometimes, but okay, so here's some examples. This is the bacteria itself. Looks like a little nothing, doesn't it? Okay, this is one that's already been lanced. You can see the little packing strip inside of it. These wounds are some that have to heal from the inside out. If the skin heals over the top of them, it's going to abscess again, and they're going to have the same problem. These have to be they have to be lanced. Sometimes you'll see them poke a hole, which I don't really think is the best way to do it anyways. They'll lance it with the scalpel and then get all of the pus out of it, and then they'll pack it with these little, they have these little medicated packing strips that they'll poke down in it. And typically, if you just go to the emergency room and they do it, they'll tell you to pull a little bit of that packing out every day, and that helps it to kind of shrink up and make that wound. But it will be a huge hole. I mean, it makes a big hole. So that one, you can see that strip. Let's see. There's another one that looks like that same one. This one has not been lanced yet. See how it's weeping? A lot of times you'll see that. And usually the skin around it is really, really, really tight. Really tight. And it'll just be like a big boil or abscess. It's not good to wait because that can get into your bloodstream. It doesn't take that long, so it's best to go ahead and get them lanced. Sometimes if it's early enough, they'll just give you antibiotics. Now this one's got some dead tissue in it, so that all is going to have to be scraped out.
It's kind of hurt.
Huh?
Does that not hurt?
Yeah, they're very, very, very painful. Just because they're so, like where it is in your skin, there's so many nerve endings in your skin that, don't puke on me.
I'm not, it's just gross.
It is gross, I agree. Here's one on the leg, shoulder. There's one that's got pus all in it. That one's been opened up. That one doesn't look too horrible yet, but
That one's been cleaned out.
this one,
That looks like it was scraped.
it looks like it just like busted open. Yeah, I'm not sure.
Because it has a big, big hole.
Afterwards, usually they'll have an actual like hole in them. I mean, like these would be completely open underneath. Destiny, does it gross you out?
Yes, because
It's not so bad when you see these a lot on babies just because of their diapers. Like you'll see them in their groin or on their bottom just because they have on diapers and, they get diaper rash and bacteria gets in there and they'll end up with an abscess. And so you see, they're a pretty normal thing to see. It's not like, and it can start with just like an infected hair follicle or something. A lot of times people say that they're spider bites. They're usually not spider bites. I know people say that and kind of makes you feel better if you think it's spider bite, but it's usually not. It could be, but it's usually a spider bite, it could do this, but it's usually just just an infection inflamed. Now, if it's an actual spider bite, like a brown recluse or something, it's not going to look like this. It's going to take away skin and meat and everything.
Like, I guess he had spiders in his turn their staff, really bad. And he ended up, lancing it himself by just squeezing it until it popped, and then he pulled this nasty looking thing out of it.
Oh.
And
Yeah.
a convenience store bathroom on the way to Kentucky. Yeah.
Well,
It was gross.
you usually need antibiotics to go with this. Usually what they give is clindamycin. Is usually their typical, what they usually use for an abscess. And they almost always are some kind of staph infection. Just because staph lives on your skin, not always MRSA, but they'll test it for that. That one looks really gross. And there's another one like that other one, with just dead tissue. They always bleed a lot when you lance them. They just bleed and bleed and bleed. But says in the community, most MRSA infections are skin infections that may appear as pustules or boils, which are often red, swollen, painful, or have pus or other drainage. They often first look like spider bites or bumps that are red, swollen, and painful. They commonly occur at sites of visible skin trauma, such as cuts or abrasions, in areas of the body covered by hair. Back of the neck, groin, buttocks, armpit, beard area. Just because a lot of times it starts out as an infected hair follicle. So, anyway. Interesting. And you see it a lot. I'm just going to show y'all. Let me see if I can find any. I'll show y'all what I was talking about with the culture. Blood culture. My computer's just not want to work today. Anything working? Well, I don't see it. Yeah, it won't, no picture, this is what it's doing. I don't have any pictures. I don't know why they don't work, so, anyway.
It's the internet, it's Google. Try Bing. That happened to me yesterday too. I think something's up with the Google animators.
I think the internet went down yesterday morning though.
Yeah, because I had to do some
Let me try
stuff.
Firefox. I was on Google Chrome, so maybe that's it.
I had to do some stuff on Miss Thornton, and I couldn't get on Google.
Yeah,
I had
Google's
to actually
acting
go
weird.
to the Google page and type it in. Usually you type it in a little bar thing.
I use most of the things, so
texting you this morning, having Clayton start. And your text says like, oh, let's go try to work.
Yep, that was me.
Yep, probably is. Cause your car. Horrible car.
Yeah, poor car in my butt.
Do we figure out what was causing the car?
They usually, whenever they do blood cultures, they have them in these little tubes. It's kind of strange looking.
Pavlars.
Let me just do a urine one. Okay, forget that. I don't know why the internet is so slow. Let's got this. Anyway, we'll just keep one. So that I can find later. Oh. Okay, let's talk about VRE. Just a little bit more.
You don't need to put the camera on you.
Oh yeah, right. Again, what would I do without her?
I don't know. Probably not make it to third period.
Probably not.
Okay, VRE, vancomycin resistant enterococcus. VRE concerns, again, same idea, hard to treat, can pass on, says VRE can pass on their drug resistant genes. So they get it, it starts reproducing, still drug resistant. Okay. So again, the other one was methicillin resistant. I know it specifically has that particular type of drug, but it's resistant to tons of different kinds. Same thing with VRE. VRE risk factors, severe illness, again, the same thing. They've been treated with lots of different antibiotics. Their immune system is down, young, old, they're in the ICU, repeated hospital stays, and so forth. Same idea. Pathogenesis, so it's opportunistic, which just means that it takes advantage of people whose immune systems are already down. That's what opportunistic means. When it has the opportunity. Bacteria transmitted between clients and healthcare workers, again, same thing with colonization versus infected. They can have it and it not actually be affecting them, or they can actually be infected with it. Signs of infection, same idea. Drainage from a wound, fever and chills, elevated white blood count, wounds that don't get better, pneumonia that won't get better. A role of healthcare workers in prevention, hand washing, wear contact, again it's contact precautions, and then follow the normal protocol. Okay, last one, gram-negative bacteria. Says, no, that sounds kind of strange. It says, gram-negative bacteria are those bacteria that do not retain a crystal violet's dye in the gram staining protocol. So it's difficult to find. And normally, whenever you, let's say I take a culture and take somebody's urine, put it on Q-tip, swab it into a petri dish, and grow it. Okay, well normally you'll take some of that and you wipe it on a microscope and you stain it. That's how you see the bacteria. Like that methicillin resistant is probably not actually purple. That's the stain. The one, you know, the picture that was up there on the CDC website. It says, so it's difficult to find. Gram-negative bacteria associated with nosocomial infections include this, and I probably may or may not be saying this correctly, but Acinetobacter baumannii, which cause bacteremia. What do you think bacteremia is? Bacteria would be what? Bacteria. Emia at the end of a word means what?
Inside.
I don't know. Too much.
We talked about anemia and leukemia. What's leukemia?
Elevated blood cell? No.
What?
Is it when you
Leukocyte.
have an overflow or something?
Anemia at the end of a word, that's one we learned last year, is blood condition. So leukemia is blood condition or abnormal blood condition of the what cells?
That is white
White blood cells. So Bacteremia would mean what then?
Condition of, I mean, bacteria.
Bacteria in your blood. Not a good thing, okay? It can cause secondary meningitis, which you've already talked about. What is meningitis? I talked about it a couple weeks ago.
Inflammation, infection somewhere.
Of the meninges, which are what?
Your
Isn't it inside
Your
your
head.
head?
Yes, meninges are the layers around the brain.
Oh yeah.
And then ventilator-associated pneumonia in intensive care units of hospital establishments. Ventilator-assisted pneumonia just means somebody who's been on a vent for a long time, so a machine's breathing for them, they can get pneumonia. Just because, have y'all ever had surgery? Any kind of surgery? They always, or maybe your family member, after surgery, they always come in with this machine, and it's got two little handles on the end and this long tube that sticks out the front, and they tell people that they need to breathe in through this machine, and it has a little ball in it, and it goes up. What they're doing is, they always have people do that after surgery, because during surgery they were laying down, because they were basically breathing for them, the machine was breathing for them, their lungs may not have opened up all the way. But when your lungs don't open up all the way, fluid sits in them. And anywhere where fluid sits, what's going to grow? Bacteria, right? So, same idea as it would anyway if you left water out or any kind of fluid out. It's going to grow mold, right? Grow bacteria. And so this ventilator-assisted pneumonia, those ventilators, they don't work like your normal breathing. I mean, it works, but it's not as efficient. So pneumonia is definitely a risk. This is Cinetobacter, probably saying that not correctly, but anyways, it's a group of bacteria commonly found in soil and water. It can also be found on the skin of healthy people, especially healthcare personnel. So we find it on their skin, just your skin normally. One of the several unique characteristics of this gram-negative bacteria is the structure of the outer membrane. This outer membrane protects the bacteria from several antibiotics, dyes, and detergents, which would normally damage the inside of it and cause it to die. So, these are some bad bugs, not something that you want to get. So make sure, if you're ever in the hospital, make sure to wash your hands. Keep your hands washed all the time. We are done with this stuff, actually.